The FDA has just approved new guidelines for lap band surgery. Those new guidelines mean an additional 26 million overweight Americans are now eligible for the operation. Joining us once again, medical correspondent Dr. Jennifer Ashton. And we should point out, you actually did a year of obesity surgery research, so you know this topic very well. When you saw these new guidelines, what do you think of them? What do they really mean?
Not really a surprise. They have to do with the criteria under which patients are eligible for obesity surgery. In the past, patients needed to be obese with a BMI or body mass index of 35 to 40. Now they've lessened that number, so they're including patients with a body mass index of 30 to 40 with one other obesity-related illness like diabetes or high blood pressure, thereby including an additional 26 million people under the potential surgical candidates category.
What kind of a message does the FDA send with these new requirements about the surgery itself?
Well, I think what it's telling us is that the obesity epidemic has reached a proportion in this country whereby diet and exercise and medications and surgery all need to be used in conjunction with each other, or we will be seeing the effects not only in our health but in our dollars and cents. This is costing billions and billions of dollars a year to treat obesity in this country. The actual lap band procedure has been out since 2001. Hundreds of thousands of patients have had it done, so we know that it has a fairly good safety profile and that it is effective. We have to remind people this is not a quick fix. This is not something that can be undertaken lightly. It has to be done in conjunction with diet and exercise and sometimes medications, and it is a major step for someone undergoing this procedure.
It's a major surgery too. It's a major expense. It's very expensive.
Absolutely.
We hear lap band, and there's also gastric bypass.
Correct.
What is the difference between the two?
A lap band is what's considered a restrictive obesity surgery procedure. So a simple band goes around the upper portion of the stomach and makes it more difficult for the patient to eat more food. So it just restricts the volume or quantity of the food that the patient takes in. The gastric bypass is what we call a malabsorptive procedure. So it affects the absorption of food and calories. Actually, people tend to lose more weight with the gastric bypass, but it's a much more extensive surgical procedure, much higher risks, and the lap band much lower risk, reversible. So again, it's more readily available for people.
Real quick, a couple of pros and cons to the lap band.
Anytime you consider surgery, Erica, there are risks and benefits. The risks with any surgery, especially when you're talking about someone who's obese, anesthesia problems, bleeding problems, infection, the band can slip and need to be replaced. Benefits, people do lose a lot of weight, but it is a lifestyle change. And I know patients who've actually had to gain weight to meet the old criteria so they could have this surgery. Hopefully these new guidelines will prevent that.
Wow. Jen, thanks for being here.
You bet.